Hello everyone, I'm Maria Piani and you're watching the Social Television Network. I'm joined today by Dr. Samad Hashimi, Director of Robotics with Norton Thoracic Institute at Dignity Health. Thanks so much for being with us. We really appreciate it. We're going to talk today about robotics and how they're changing things with esophageal cancer when it comes to treatment. Tell me about, how are people diagnosed with esophageal cancer?
So esophageal cancer can be diagnosed in a number of different ways. The easiest way, most of us don't go to a doctor unless you have a symptom. Right. So if people have a difficult time swallowing and they can't swallow food, they usually will go to a physician and then they get their primary care or their gastroenterologist, they get an endoscopy and they find a tumor. Or some people go for like colon cancer screening and they at the same time they have a long history of reflux, they get an upper endoscopy at the same time and they find out that they have a tumor at that point, and that's how they come into the realm of treatment.
Let's talk about treatment, robotics, and how's that really changed how you treat esophageal cancer?
So from a surgical standpoint, there's a number of different ways that you can approach esophageal cancer. Most of them historically has always been an open operation, which means you open up somebody's abdomen and open up somebody's chest and resect the tumor and then reconstruct them, either with their stomach, colon, small bowel, whatever. But those operations are long, they're painful. So with the minimally invasive platforms, which is basically laparoscopic, thoracoscopic, or robotics. Robotics is the ultimate in minimally invasive platform. They have smaller incisions. They recover a lot quicker. Their fluid requirements are a lot less. Their narcotic use is less. They get back to their work or whatever daily activity a lot quicker. So that's what nowadays we can do pretty much all with a minimally invasive approach and hopefully get them back to their daily living.
Now, can you kind of maybe describe to us how long a patient would be in the hospital with either the robotic or the more invasive surgery? So
for a robotic esophagectomy, we still keep the patients in the hospital for about 5 days just to make sure they're doing okay, they start their diet and eating, and once everybody has a feeding tube. Once they're able to eat normally, their feeding tube comes out. For open esophagectomy, they can stay in the hospital anywhere from a week to 2 weeks, and then it takes them, the difference becomes usually in narcotic use and how soon they recover, because the open operations hurt a little bit more. So their return to full duty activity is a lot longer than it is for a minimally invasive platform. So
and what you really want to do is try to get those patients back to their normal lives.
That's the ultimate goal.
All right, thank you. If you would like more information about esophageal cancer with the use of robotics, you can click the link right there that you see on your screen, or you can call the phone number. Thanks so much for being with us. We really appreciate it today. You're watching the Social Television Network. I'm Maria Piani. We'll see you back here the next time.